So talk about the career path. Do you tell your story? And then I want to talk a little bit about the career path for dental assistants too, so we can kind of expand our thinking about how dental assistant can be such an incredible entree into this incredible profession that next year it's going to do almost $160 billion industry. Okay, I mean, it's a massive industry, and we get to help people. So tell your story a little bit.
For all the dental assistants out there, and thank you for joining. We see the comments coming in from DFW, San Antonio, Florida, Massachusetts, California. We're so excited to be with you today. For those that have not met me in person, I started in the industry when I was 17 years old, and I was in high school. I was getting ready for prom, graduation. I wasn't thinking about where my career was going to go, or if I needed benefits, or what I wanted to do. I was excited to graduate high school and then to go into college. And I think that's where it really changed. I was working with patients on a daily basis that were connecting with me and loved and adored me as a dental assistant. So loved and adored me, but they loved and adored the role I was playing in their dentistry as a dental assistant. So from there, I went on, became a registered dental assistant in the state of California. That's our career path here to go in. We take our exams, we become a registered dental assistant. But then in PDS, you can go a little bit further if you want to stay on that path of dental assisting. And I became a lead dental assistant. Spent 7 years there, loved it. But now I wanted to
talk about that role real quick though, because a lot of people might not, sorry about the background noise. What does it mean to be a lead dental assistant? Real quick.
So
a big
now
job.
I am working with what we've referred to as the Trinity of Dentistry. A great owner, or not great, phenomenal, because I got to work with a phenomenal owner doctor, so not great, a phenomenal owner doctor, and a phenomenal office manager who still support me, and I know are on this call today. So shout out to them thank you for that support. I worked with them on now how do we build a practice. It wasn't de novo, Steve, or what we call it de novo. And it was not heavy, patient flow was not there in the beginning. You're ramping up a practice, it's day one, you need to build your brand in the community. So I was a part of that building of that brand and bringing patients into the practice. You name it, I did it as a lead assistant. From developing my dental assistants, developing associate dentists that were coming in as new grads and working with them hand in hand.
A lot of people would laugh at that one. Developing the dentist, the new dentist, a lot of people get a kick out of that one. Yeah.
I think one thing with the pediatric side, we added specialty. 2 years in, we added specialty. Pedo came in. I played the tooth fairy in the local community. So I was a tooth fairy, and now you got to see your dental assistant, and kids were like, my dental assistant's a tooth fairy, Mom. That's right. And that grew as our patient flow, what we were in the community. So it was not only, it's not ordering supplies and budgeting. That's a task that we do. In the lead role, you're developing talent, you're fostering talent, and you're owning your own development. I think that was key for how I was going to move on next.
Great.
Because I got to then complete my undergrad at La Sierra University, was going to school full time. So PDS helped with that too as well. And I had an owner doctor that supported it, going to school full time, working full time, but I was there. The morning, midday, afternoon, I was still working full 40 hours a week and going to school. Still don't know how I pulled it off. We move forward and I meet Joanna Rogers and a team of now phenomenal owner doctors in a region that I get to support 70 back offices. Wow. And that's our regional back office trainer and manager role, Steve. And now I got to go to see Corona World. I got to go to Iva Clark's training center in Buffalo, New York, where clinicians go and learn the technology hands-on. What other organization can you go and have that level of training? Then master's comes. Let's get a little bit more education under the belt. I'm still growing up this ladder and I'm not done. And then I get appointed to the California Dental Board by Governor Brown. It's been a phenomenal ride of, sky's the limit, but I asked for the support and what else can I do? How can I help you? And I'm the yes girl. I don't say no to an opportunity. I will be there and I'll find a way to get there.
So let me ask you this, what's next? You continue to rise up.
So I have some exciting news to share with you, Steve, and this kind of just happened. I got accepted into a PhD program at La Sierra University. So we'll see. It's going to be a journey, but it's brand new news to me. I'm very grateful for now the doctors that I get to collaborate with at La Sierra University. But a PhD may be what we're speaking to 4 years from now and celebrating.
Well, if I have any input, study the mouth-body connection. If I have any,
That's my research project.
That's your research. So congratulations on that. That is absolutely awesome. So there's also other opportunities for dental assistants, right? They can once they learn the kind of the back of the house, so to speak, right? They can move to the front of the house if they want. Talk about that, because a lot of dental assistants have taken a different career path and gone the other way, more on the admin and business and biz development and that.
So yeah, and that was a career path that I was presented with by one of my regional managers. And it was really going from that lead dental assistant role and now taking my talents as a dental assistant and going into a BC or a benefits coordinator or a specialty benefits coordinator. And going from there and then into what we call an office manager in training and then an office manager.
Right.
That's a development when you lay it out. And that's one thing me and my regional manager always talked about management was, what does that progress look like? 6 months, 12 months. And that's something I really want to share with dental assistants. It doesn't happen overnight. You don't wave a wand, 90 days later, you get a new title. It's steps and stepping stones you take to get there. But you're going into that admin house. I could not be on a phone, Steve, so I couldn't do that. Like picking up a phone and taking insurances, not my forte. But I have worked with great DAs who do it and they excel at it. Because now they're taking that back office knowledge and being able to treatment plan a case for their clinician and collaborate there and go ahead and put it in front of their patient. And they know all the terminology right off the bat. Why wouldn't you want a dental assistant to be your office manager?
Right. Dental assistants with good administrative skills and that drive for the business side, they make incredible operations managers. Incredible. There's different paths. I'm not saying one's better than the other. You chose your path. It's awesome. You're skyrocketing. And then there's the other path too. That's so many. So the opportunities for the profession of dental assisting they're just amazing right now. Absolutely. They can go, there's one other area they can go in an organization like ours, which is into more on the support side too, right? On the support level, you're kind of in there in between the support level and being on an accounting team, on a finance team, on a marketing team, wherever they want to go once they've learned the profession, huh?
Yeah, no, I completely agree. And one thing I want to kind of toss in there, Steve, is staying chair side. PDS has a phenomenal platform for that too, because you're elevating your personal and professional skills. Personal skills, your professional skills, and your clinical. You can add additional certifications. Do you want to do specialty? Shout out to all our OS, our perio, our endo, ortho. You guys took it a step further and wanted to specialize in providing patient care when it's putting on brackets and banding a patient same day.
Right.
I know I can't do that, and I'm grateful for the DAs who do have that talent in them, because that's truly unique. And then our OS assistants, putting an IV in for the additional certifications and going in, you're helping your clinician. We're seeing more patients and being able to provide more dentistry for that community because you added that certification to your belt.
Right. I call it expanded function. So in my lifetime in career in this profession, 32 years now, the role of the dental assistant continues to be able to do more things year after year. Maybe it's slow, like you just said, those different roles, the different titles, different degrees. I call it expanded functions. They can keep going more and more, and I don't think that's going to stop. There's going to be a lot more available for dental assistants who want to be in the practice of dentistry and just be exceptional dental assistants. So much opportunity for them. So I want to encourage that too. So again, so many paths for dental assistants to go after. What do you think? Let me ask you another question here. What do you, when you think about the role, the profession of dental assisting, what do we need to do to elevate it so we attract way more people to the role of dental assisting?
So see, you get transparency with me. Many of the people on the call know that you get transparency with Rose. One thing, I have two big things that
Okay.
I'm really focused on in the industry too as
Okay.
well. Working with managers or any type of management to help articulate that career path for the dental assistant, wherever they want to go. That's one thing that I'm constantly working on and speaking to. And
Can
the other
I
one,
make a comment on that?
yeah,
I love what
absolutely.
you just said. It's the way I teach it too is you're not joining my journey. I'm joining your journey. My job is to help you excel and grow. And that communication between the dental assistant that just came on board, it could be even an extern that just came on board, that conversation between them and that operations manager to help them elevate their career is so important. I want to encourage everybody out there to continue to do that. So I want to double click on that because it's so important.
And absolutely. And then the next thing, a lot of dental assistants text me, DM me, whatever communication they want. But the other thing we're really focused on is compensation and ensuring that, the broadband is appropriate for our profession.
Right.
ADA does articles on this. There's tons of dental assistant communities and networks. DA, Rockstar podcast. There's the collaborate. What does that broadband look like for a dental assistant at each level of their development?
Right.
And I think that's a key component too coming in. It's not that this dollar is at this stage. It's an ongoing conversation to take you from $1 amount to another dollar amount, and then to keep your job, to keep the conversation going and ask. And that's one thing, as dental assistants, we really want your support in, Steve, of how is that kind of conversation is ongoing and evolving as each year comes.
Yeah, and you and I know that we agree on that, and we need to work on how we elevate that career path and the financial career path for the dental assisting profession for sure, all throughout the industry. So it starts with employers who pay for dental plans. It goes to the dental plans who pay the fees, patients who pay the fees, and the overall financial impact dental assistants can have. One of the things we've seen right through this crisis is that we can do a lot more with less. And when we do that, it frees up money that can be paid to dental assistants. I totally agree with you.
And then the last one, Steve, is, when I say industry affairs, I'm speaking to boards and dental assisting councils, getting DAs involved in that part. I was in Tennessee, this was about a year ago, and I remember one of the schools and some of the DAs I was collaborating with were, Rose, how did you keep a dental assistant council going in California, where they really are the advisors to the dental board for recommendations of what needs to happen with, certifications, expanding the clinical, scope of a dental assistant in California, because in Tennessee, it had dissolved or was no longer being appointed to the dental assisting council. So that's really another thing I strive for now, sitting on a board. I'm still learning. I'm only 2 years in. The lingo is like a foreign language to me some days. I'm sitting on there like, what did he just say? And I'm looking to Dr. Morrow or Dr. Stewart. I'm like, can you whisper in my ear what that was? So I think that's the other piece of it too, getting involved also on the dental boards, associations, and dental assisting councils in your community so we can create that change.
I think there's a whole nother level coming your way too, Rose, since you are so passionate about this. It's getting, as we move towards the dental medical integration, I'm going to throw one out there for you. We're going to be moving into a whole nother realm of overall health for patients too, not just their oral health. And I really believe dentists can play such a critical role in primary care, healthcare for the future of people in the United States and the world, and that dental assistants will play a vital role in that whole spectrum of changes that are happening. It's super exciting.